How to change the stoma bag using the one-piece system. Step 1. Prepare the requisites required to change the stoma bag. You may pause the video to check all the requisites required. Step 2. Spray the adhesive remover on the surrounding wafer area for a gentle removal of the wafer from the skin. Gently lift the edge of the adhesive wafer from top to bottom while running your finger gently across to loosen the adhesive. Step 3. Use a wet kitchen towel tissue or baby wipes to clean the surrounding area in a circular motion. Make sure to clean off all fecal matter, bodily fluids, as well as adhesive stains off the skin. Use a fresh kitchen towel tissue to then dry the surrounding stoma area. You can now take the opportunity to inspect the stoma area and surrounding skin for signs of common complications such as redness, skin erosions, rashes, or bleeding. Step 4. Spray the protective skin barrier on the surrounding stoma area and let it dry sufficiently before applying the new bag. Step 5. Measure the stoma shape and size using the measuring guide. This is suitable if your stoma is rounded. However, if the stoma shape is not rounded, use a transparent plastic sheet to trace the size and shape of the stoma, keeping in mind the orientation and position of the stoma. Cut the tracing line to create the template for your stoma bag cutting. Make sure not to leave any sharp edges along the template. Place your template over the stoma to test for the size. With that, your stoma bag should be placed over, flipped around, and trace the exact size of the stoma onto the wafer backing. Cut the marked area on the stoma bag wafer, making sure not to leave any jagged edges. The wafer needs to be cut according to the size of the stoma to prevent any skin irritation. Smoothen the cut wafer edge with a finger to ensure no jagged edges remain, and snip the surrounding wafer area with your scissors to allow better sticking onto the abdomen. Step 6. Apply the stoma adhesive ring to the skin around the stoma. You can stretch and knead your stoma adhesive ring to fit the size and shape of the stoma. Including a seal in the application of the stoma bag will allow better adhesion and prevent future leaks. Make sure to remove the plastic backing before applying the new stoma bag. Step 7. Align the stoma bag and apply it to the skin. Add extra pressure to the areas with adhesive to allow a more secure fit to the skin. Ensuring that the skin is clean and dry before application also helps for a much more secure fit. Remember to seal the opening of the stoma bag with the provided Velcro tabs. Remain in the same position for 10 to 15 minutes after changing the stoma bag. And make sure you wash your hands before and after every stoma bag change. Here are some extra tips on how to take care of your stoma bag. The stoma nurse or colorectal resident nurse will review your stoma and guide you in your stoma care journey.